All right. So there's no doubt about it, as you can see from the description of today's show, we're going to be talking about something that hits really close to home for me down here in Florida. This really does look, sound, and smell a lot like scientific fraud to me. I'd love to hear what you have to say about this, what's going on down here in Florida in the United States. I don't know where you are in your part of the country, but I can tell you this. What's happening here in this state is going to definitely be found out in many other places as well from the looks of what's going on here. This should be huge news, huge story. And you know what? Most of the mainstream media won't even touch this, that's for sure. So the big question is, what's going on down here in Florida and why? We'll address some of those things today. Hi, I'm Jonathan Landsman, your host for Natural Health 365 Live. We do this broadcast that you're watching right now every single day from Monday to Friday at 12 noon Eastern Time. We do another show just like this each day, really thinking about your immune system, how we can help you to improve the function of your immune system, to be well educated about it, how to keep yourself healthy, which will obviously protect your future health as well. By the way, if you're new to this program, please type new in the comments section below so we can give you a big, warm welcome. Really want to let you know that we're happy that you're a part of our community. Okay, so basically, there's this local news station down here in Florida, in Orlando, Florida, that was doing this investigating about everything that's been in the national news, for that matter, about what's happening here in the state of Florida, right? Obviously, a lot of people have been hearing that basically Florida's become the epicenter of this whole coronavirus issue, and that the cases are going up at an alarming rate, right? Scary news, no doubt, for the general public listening to this information on TV. It's enough to make a lot of people really scared to go outside and see anybody at all. In fact, there have been some healthcare providers that are suggesting that even when you're in your house, because of how they see this whole second wave happening and more cases, especially in Florida, you need to be careful even inside your home, right? So I think most people watching the show, they already get where I'm coming from. There's a tremendous amount of fear-mongering going on centered around this issue about a virus, right? So anyway, back to this news agency locally in Orlando that looked into all of these cases that are just shooting up like crazy. Where are they coming from? What's going on here? And in particular, I'm sure maybe you haven't heard, but the latest news is some of these labs that are doing testing of individuals, 100%, and not just one lab, dozens of labs here in Florida are coming back, and somehow in their report, we're supposed to believe that 100% of the people tested are positive. It's unbelievable. The numbers, of course, are going to go through the roof. But what's going on here? Let's look at the details. The Florida Department of Health, which is like sort of that governing body, right, to let all the people in Florida know whether it's healthy to be outside or not, right? This is their charge, to watch over the health of everybody here in Florida. They're supposedly the top experts, right? They're telling us that the reports are there's a very high rate of positive coming out from these labs. They claim, as I mentioned before, dozens of labs in Florida are reporting 100% positive test results. Now, I think anybody in their right mind would be like, this is a little strange. Why would everybody be coming across positive? Not one negative? Not one? So the labs, in truth, actually have way lower numbers. So what's going on here? Florida Department of Health says 100%. The labs themselves are saying, no, not really. Let me give you an example, couple, from their investigation, this news agency. Number one, the report showed that Orlando Health, which is, if you're not familiar, big operation down here in Florida. They have lots of hospitals. The report showed that Orlando Health had a 98% positivity rate. That's pretty high, right? However, when investigators contacted the hospital, they confirmed there were errors in the state report. Of course, like I've often said before, there's a lot of vagueness here, a lot of stuff out of context, right? They like to sort of downplay it like it's, just some little errors, right? No big deal. Everybody stay relaxed. You see this theme a lot in healthcare when it comes to things that don't look and smell and sound right. They'll always make it seem like it's just some minor little errors. Errors? Orlando Health's positivity rate is only 9.4%, not 98%. Now, look, folks, I don't know about you and your right mind, right? But if we're talking about a 98% positivity, and actually it was more like 96.5, I wouldn't even be doing a broadcast like this. But what is going on here? How can the Florida Department of Health be saying something as high as 98? I mean, I can't believe what I'm saying here. And the hospital is saying it's 9.4. Is there any science going on here? Why would the Department of Health in Florida have such a jacked up number? Why on earth would that be happening? Doesn't make any sense to me at all. Number two, Orlando's Veterans Medical Center, another operation down here, had a positivity rate of 76%. Pretty darn high, right? But a spokesperson for the VA, right, told investigators that this does not reflect their numbers and that the positivity rate for the center, are you sitting down, is 6%. Folks, something's really wrong here. And I know they say they're investigating, but I would almost venture to say I could even put money on this. Not that I want to bet any of you out there. This is not about betting money and making money. But I would bet to say that that's about all we're ever going to hear in the mainstream media. Are we ever going to get to the bottom of this? Are we ever going to find out why there's such a wide gap between what the Department of Health in Florida is pushing? And mind you, this is the department that drives all the media. It drives everything, all the information that people are getting in the mainstream media. Should we wear a mask or not? Are the cases going up or not? They're the boss. They're the authorities. They're the experts, right? Should we have school in the fall or not? Is it safe to go outside or not? Is this virus coming under control or is it rapidly going out of control? We rely on the Department of Health to give us accurate, real statistics, numbers, test results, day in and day out for a wide variety of health issues. This obviously being probably the most important health issue of your lifetime. And yet the discrepancy is huge. Of course, the Florida Department of Health is blaming guess who? Oh my goodness, we made a mistake. We're very sorry. Of course not. They're blaming the labs. The labs need to understand things a little bit better. So, you see this all the time. People pointing the finger at each other. Nobody wants to take self-responsibility. You see this time and again in the modern conventional healthcare system. They say this, and I'll give you a quote. It's a beauty. The department immediately began working with those labs to ensure that all results were being reported. All results? I thought all results were being reported. This is odd. That all results are being reported in order to provide comprehensive and transparent data. So we're supposed to have this much greater trust now in the Department of Health in Florida. They go on to say, as the state continues to receive results from various labs, the department will continue to educate these labs on proper protocols for reporting COVID-19 test results. So at the very least, folks, they're admitting there is major confusion about how to report a result. Positive, negative. I guess it's very complicated. But do you see how these answers are exactly why most common sense people out there who think for themselves, listen to what's going on, and make these evaluations for themselves, they question and they don't trust these local and even on a federal level, these government health agencies. The question remains, does Florida really have 15,000 plus cases a day? Look, I'm sure at the time that you watch this, might be a day or two after the live broadcast, these numbers are going to continue to fly up in the air. We're going to see way more than what I just said. But does it make sense to you, just on a common sense level? 15,000 cases a day. Before it was like very quiet in Florida. A month ago, not a whisper like this. In fact, it was even characterized as quite odd, if you think about it. We've already covered the fact that most people that have actually died, a very big portion, let's put it that way, are the elderly in nursing homes. Now, you would think Florida has a much older population, right? People from the north moving down into Florida, it would be littered with so many deaths. Yet New York was huge for the longest time, and Florida was very quiet. But now, all of a sudden, in this month, Florida has gotten out of hand. Cases are shooting up like crazy. Where is this coming from? Have people changed their lifestyle so much? If anything, this is something I just thought about as I'm speaking to you here. If anything, more people, and I've seen this just, on a personal level, more people are wearing a mask today, and certainly in the last few weeks, than I ever saw at the beginning. Everywhere I go, people wear a mask. Everywhere I go, people are clearly more concerned about the virus, social distancing. I've even seen how stores have plexiglass. They have plastic now, not just hard plastic, I should say, not just the paper plastic. So they're getting their game together. You know what I mean? The hand wipes, everything's like been in gear for months. So you would think everything is just more careful and even more in control, yet Florida is flipping out. There's more cases than ever. And we've talked about the inaccuracy of these tests already. We've also talked about, and it's not much in the news at all, but still there's the issue of whoever does actually get tested positive, the probable cases are included as cases as well. If you're new to this, probable cases mean if you're tagged as being positive from one of these tests that are highly inaccurate, anyone you've been around, your mother, your father, your brother, your sister, coworkers, even before they're tested, they're labeled as probable cases, and those are counted as cases. And that's exactly when we saw these numbers start to shoot up at the end of June into July in many areas. But Florida has clearly become this epicenter of this disease outbreak, right? That we have to be so concerned about. So a lot of people are thinking there's definitely some fraud going on here. Remember, people are emailing not just me. I won't bring up some of the others just to respect their own businesses, but there are other people in the business just like me, the natural health world. They have websites. They have very large followings, and people are emailing them just like they've been emailing me, and I've been reporting this to you about how they've stood online to get tested, and the lines are so long, they're so slow that they just give up. They filled out the paperwork to get tested, but they walk away from the area, from the lab, before they actually get tested. And then later, they get a letter, "Hi, Mr. Jones, Mrs. Jones, you're positive." Yet they never got tested. What the heck is going on here? And I also mentioned to you as well that leader of an African country, remember, that was done a while ago as an early warning sign that something's really wrong going on here about this testing. How a piece of fruit, he intentionally put it to a human name, submitted the material, the test, and the test came back positive. A piece of fruit came back positive. Okay, not even a human being. He made it up. I mean, it just shows you something is going on. So can we really trust our government? Obviously, I know a lot of people follow my work. They have healthy skepticism. But if you're new to this program, I suggest you look into a lot of the things I've mentioned. Check out some of the reports about this. They're hard to find, but they are out there. And by the way, if you've been following me for a while, please do me a big favor. Get this information out to more people. Please share it with someone you know, a friend, a family member. Just tag them in the comment area and send this show to them. It really helps us to get this message out to more people because these social media giants who love to kind of keep this news quiet, you know, the algorithms will still drive in our direction if we get more people to share and engage and make comments. They can't hold us all down, folks. So let's get busy, let's stay together, and let's help to get this message out there. So the second wave that we're hearing a lot about, maybe you haven't yet, but I guarantee you, as we get closer to the election time, November, there is no doubt in my mind, August, September, and October, you are going to see the screws tighten like never before. There's going to be more alarming news about a second wave. There's going to be more alarming news across the country how more and more Americans are being infected, and watch out, and there's more and more cases. But you notice how you're not getting a lot of detail, not only about the cases, but about who is actually going into a hospital and who, God forbid, might actually be dying. We're not hearing a stitch of information like that in the news. The most alarming thing we're hearing is cases are going up. And I think by now you can certainly see that these cases, it's a little strange. And this reminds me, and I'm sure it reminds you, of so much other fraud cases that, you know what? Many people don't even know about this CDC scandal. I mean, the United States Centers for Disease Control and Prevention, they were at a scandal and they seem to have slithered away from it. But their own top scientists on research papers about the MMR vaccine actually said that they were destroying data, destroying scientific evidence from their research, and manipulating data to make it look like the MMR vaccine is perfectly fine in small children, especially African American boys. And yet, the truth was, the data suggested strongly that there was a major risk that African American young children got the MMR vaccine and were at a way higher risk of getting autism. It's destroying these children's lives. And yet the choice that the CDC had was to gather all the scientists together in a meeting, started destroying the evidence and manipulating the data to make it look like there was no problem at all. And one of their top scientists, William Thompson, who still was there after he blew the whistle on this, said, I can't take it anymore. I've got to tell the truth. Doesn't that make you wonder what's going on at the highest levels? Now, I don't think most people have a clue what's going on. I think there are a lot of well-intentioned healthcare providers out there, all those lab technicians doing the testing. They think they're really doing something good in this country. I don't think they have any idea about the level of fraud that I'm describing to you here that seems to be very clearly at the very top of the pyramid. And that's what's happening here. Destroying evidence, manipulating data shouldn't be something that any of us accept at all. And there are loads of other examples of healthcare fraud directly connected to financial incentive. What else would it be, folks? Only in the last few years, to the tune of billions of dollars, that other federal agencies, like the Food and Drug Administration, have actually been able to go after Medicare fraud, false reporting, cooking the books, if you will, so that certain people could be enriched by all the fraud that they perpetrated through Medicare and through so many other situations. We have lots of examples of big pharma manipulating the data, making their drugs seem fine so that they can get approved and then they can sell it to the public. When it comes to vaccines, we've actually seen vaccine meetings where all the doctors get together. And of course, raise your hand if you have any reservations. And of course, none of the doctors raise their hand, about pushing forward and getting a vaccine put onto the vaccine schedule. And in the conversation, you'll sometimes see a doctor say, well, I'm just wondering about safety. And the response in one particular video that I'm thinking of now really summarized an attitude that they have most of the time. Well, this woman said, who was kind of in charge of the meeting, we'll just roll out the vaccine and we'll watch it very carefully. In other words, use human beings as guinea pigs, and we'll see what happens clinically after the injections get administered. If there's a problem, then we'll deal with it at that time. Yet that's the opposite of what most people think. Most people think, come on, Jonathan, the uninformed public. They know what they're doing. They're public health experts. They have these very fancy tests. They've done lots of research. They know how to do everything. And nothing could be further from the truth more times than you can imagine. So anyway, why would they commit this fraud? Jonathan, why are you bringing this up? Again, I've already kind of alluded to the fact that there's a lot of money involved. We've covered that on many shows before. The more quickly you can label someone with COVID, and then if they get into the hospital, you definitely want to label them that because you get paid much more as a patient. The hospital's earning a lot more money, and then as they keep doing more and more testing, they're earning more and more revenue. So there's a tremendous incentive to go in the COVID direction. That's clear. So are they hyping up the fear? Yes, there's a virus. Please don't misunderstand me. Absolutely, there's a virus. What's the big deal to admit that? There's lots of bacteria, lots of viruses we're exposed to every day. They get in our body, they don't get in our body, they replicate a little bit, they don't replicate, they replicate a lot, and we feel lousy, and then we recover. Folks, this is happening every single day to a ton of people, right? This is nothing new. So are they hyping it up for fear? And why would they be doing that? Fear certainly seems to be a strategy that's used a lot in the mainstream media and in conventional medicine. And that would be for what reason? I'm sure you can understand. To push medical interventions. Oh my God, for example, this virus. What's the only thing that you hear out of their mouths? It's getting worse and worse. There's only one way to get back to normal. We need to get the injection. The solution has to be injected into people so that our society is safe and we can get back to normal. And most people don't even think twice about the hidden agenda of making a fortune and forcing people to do something against their will or if they're uninformed about it. A lot of people are waking up to the fact that that process is just wrong. You should be able to inform people, let them know, and then let them make a decision. Maybe another reason for all this fraud is just to help destroy the economy. A lot of people are fed up with it at this point, that because of this virus, businesses aren't supposed to be open. In fact, we see that now, the rolling back of businesses being open. California just laid down the law for the entire state. Bars, restaurants, shut them down. Again, you can't be in business because of this virus. So it's the state telling the individual what to do. And it's for your own good. Of course, that's what they say on the surface. But when you see all this fraud, when so many people are now wondering how serious a problem this really is, forget about the other ideas that I've brought up so many times before. Why aren't they teaching people how to have healthier, better immune systems? Why aren't all of these supposedly caring individuals working every day to improve the quality of our water and our food supply and making the population healthier and healthier? Instead, they approve chemicals that get dumped into the water. They approve chemicals that get dumped into our food supply. I mean, it goes on and on. They don't do anything to help nourish and improve the function of people's immune system, which would naturally defend us against bacterial and viral infections. But they don't even teach that to people. So a lot of people are waking up to the fact that they're full of crap. They don't really care about the individual. And that's a hard thing to hear when you're new to this information, but I'm sure you understand where I'm coming from. Also, a lot of people are concerned, not only destroying the economy, but basically, as I've mentioned before, denying medical freedom. Whatever happened to that? Your doctor tells you, look, we tested you, this, that, here are your options, this, that, educate you the best the doctor can, and then it's up to the individual to make a decision. What kind of cancer treatment do you want? Cardiovascular interventions, bacterial or viral therapies. What will you do should ultimately be your decision as a patient, not the state, not a government mandate, and not even at a doctor's level. Look, bottom line is, if you don't like the advice of your doctor, it's called a second opinion. But now we're stepping into an area that is really very, very dangerous. And this is just the beginning. It's going to get way worse. What the state wants to shove down people's throats. And that's what I know a lot of you are very concerned about. They can put out any information they want, but they should still allow the individual to choose what they think is best for themselves and for their family. And then, of course, the other thing that seems very clear is a lot of politicians are loving this fear and locking things down because it gives them a great sense of power and control over people. Now, I know that sounds crazy, right? Because we're all good-hearted people. Boy, if I was a political leader, I wouldn't do that to people, Jonathan. That's crazy what you're saying. But believe you me, there are clearly many political leaders that are in power today that are definitely power hungry and pushing this agenda of fear, cases going up, and the state coming in and telling people how to live their lives definitely is something of a motive why they would be behind everything that we're hearing in this news. All right, so that's basically it for today. We're going to keep an eye on all of these stories, as you know, and any of the other ones that are going to be coming up in the near future. I am sure there's going to be a lot more to report on. Question of the day today: do you think this pandemic will A, destroy the U.S. economy, B, eliminate personal medical freedom, C, do nothing and we'll get back to normal, or D, something else? We put other And you tell us. You fill in the blank. So that's basically it. If you feel like this show needs to get in front of somebody, please do us a big favor. I really would appreciate it if you would tag somebody in the comment section. Please share this show with someone that you love, family, a friend. Do it now. It'll help us to get this message out to people. We really appreciate it. And just as a reminder, the Natural Health 365 live broadcast goes out every single day, Monday to Friday at 12 noon Eastern Time. We create another new show just like this for you to help you to improve your immune system function. And obviously, we're all focused on protecting your health. Thanks a lot for joining us today, and I look forward to speaking to you again soon. Take care, everybody. All right, Instagram, do your thing.